Thank you, Mr. Chairman. I just have a question, actually, for Senator Coons or any others, probably Senator Coons. I'm deeply concerned about the potential effects here on generic drugs and generic drug prices. I see that quite a number of advocacy groups share those concerns. You just referenced, Senator Klobuchar just referenced changes that you're making in this manager's amendment to try and address that problem. I'd like to hear an explanation of that if we could before we vote. I'm sympathetic to what you're trying to do here, but I can't support something that's going to increase the cost of prescription drugs for millions of Americans, and I'm deeply concerned that that's going to be the effect of this bill. So I'd like to hear what you're doing to address that.
Thank you, Senator Hawley. And as you've heard, a number of my colleagues, this has been their principal concern. We've worked over a number of months to get specific language that makes it clear that biosimilars and generics and patient advocacy groups retain. There was a concern that the standing requirement would knock them out. And the goal here was to prevent some gamesmanship at PTAB using shell companies and using transfers of ownership. And the concern was that the standing requirement would knock out patient advocacy groups and biosimilars, and thus the potential for generics to come to the market. There is specific language in the manager's amendment that addresses that concern sufficiently that longtime and fierce advocates for this issue, like Senators Klobuchar and Blumenthal and Welch, have joined and committed to voting for the bill, given what's in the manager's amendment.
Chair Durham.
Senator Tillis, of course.
Senator Hawley, you raised a good point. Back in the mid-'80s, I was a research and development manager up at Wang Laboratories, tech company, but Wang Laboratories in Boston. And when I was making a judgment about the viability, the market viability of a new technology that some engineer or some software developer brought to me, I had to go through and make an assessment about whether or not it was worth the long-term investment based upon how long I would be able to maintain intellectual property, gain a patent on it. If I wasn't sure, then I would never, if I wasn't sure that I had a long enough tail to recoup what could be oftentimes a very high investment, then I wouldn't authorize the project. Well, in a similar fashion, I think that people who are against this bill may be, I think, obfuscating what's really happening in terms of drug pricing. And I've tried to tell everybody this. I've told the PBMs, I've told the healthcare providers, I've told the doctors, I've told the insurance companies, and I've told the pharmaceutical companies. Every single one of them needs a haircut, but they all need to be in the barbershop. Here's what happens. The PBMs say it's the pharmaceutical company. The insurers say it's the doctors, because or the pharmacists, who are oftentimes also PBMs, say it's everybody else. And they're all kind of right, but they're all very wrong. And if we really want to get to a construct to where, instead of high-fiving when we do arbitrary price cuts on drugs, I'm going to get back to why I talked about my experience at Wang Laboratories, these arbitrary price cuts that are unsustainable. I'll give you a good example. It was in Finance Committee when our colleagues, over the objections of every single one of us, put in price controls, a haircut for the pharmaceutical industry. They all high-fived. They said, we're reducing the price of pharmaceutical drugs. What they failed to mention is that there were several board meetings of several biotechs who said they were going to slash their small molecule research budget by as much as 50 or 60%. This is publicly recorded board meetings. So I guess the point that I'm making is the cost of a drug that is never developed is zero. And so are the benefits to the patients and the victims who could benefit from it. So this is not something that is structurally going to increase it. It is something that I, as if I were an R&D manager at a pharmaceutical company, would say, I have some certainty over the protection of my intellectual property, so I'm going to invest in that rare disease research, which almost always goes off the table because there's very little revenue tail to justify it. So if we don't provide more certainty in terms of, and we we always talk about the rich pharmaceutical companies. We don't talk about the billion-dollar bust on an Alzheimer's drug, right? We only talk about the ones that make it and they're making money off of. But that's a portfolio that we only talk about the success, we never talk about the failure. And if we don't provide certainty for intellectual property protection, I guarantee you, my counterpart, like the Tom Tillis of 1985, is going to say, no can do. I'd love to serve that population of 5,000 or 10,000 people who are suffering from this disease, but the numbers don't work.
Mr. Chairman.
Senator Coons?
To my colleague, Senator Hawley, I have the specific language now in the manager's amendment that defines a nonprofit, that is defined in a way that a patient advocacy group or a generic that is trying to bring a drug to the market and wants to test the patent protection of the branded drug, to make it clear, and this is what brought along several of my colleagues, to make it clear that these reforms in terms of standing would not advance what have been some gamesmanship by Big Pharma to use patents to rise prices. So I'm happy to share this language with you if that's helpful.
We have Senator